Leapfrog is very proud to partner with Costs of Care on this wonderful award. Costs of Care is a nonprofit that cultivates change agents just like Leapfrog does. They are focused on more affordable and equitable healthcare system, and we are focused on quality and safety. We consider all of those things the same issue for every patient. So together we award the Steven Schroeder Award for Outstanding Healthcare CEO. We believe in the power of leadership. This award recognizes a hospital and/or health system CEO who has demonstrated courageous and ethical leadership addressing the twin issues of affordability and quality of care in their community. Again, we do not see those as divided issues. No patient sees them as divided. What you can afford and the quality of care you get are the same issue to you as a patient. It's my pleasure to pass it on to Dr. Tino to talk a little bit more about costs of care and announce this year's winner. And I will add, this was a very competitive year. We had a number of very competitive applications for CEOs. So go home and tell your CEOs to compete next year, please.
Thank you so much. My name's Fumiko. I came from New York City. I'm a treating radiation oncologist at Memorial Sloan Kettering Cancer Center in New York. I know affordability is a huge issue for our patients. It's something that I see in my clinic every single day, but it's also something that I've experienced myself. And I wanted to share you just a little bit about my history to try to emphasize for you how common affordability gaps are in our healthcare system. I was never supposed to be a physician. I was an art director of an entertainment company when my husband was diagnosed with cancer in his 20s. We faced incredible bills with his care. Those medical bills, that medical debt followed me for a decade after he died from cancer. And when I think about that experience, I know that it's happening, sadly, even more commonly now than it did over a decade ago when he died. I was called by a debt collector at his funeral. It's shocking to think that this problem is developed even further in our society with all of our riches. I've been working with the Cost of Care group for over 5 years to think about how do we motivate the next generation of change agents? How do we heal healthcare from within to try to promote the next leaders, the next visionaries, the next generation of people who are going to try to knit our broken healthcare system back together? Because when we know affordability is a barrier, we know that patients aren't getting the highest quality of care. We know that they're having to make their own sacrifices in order to afford care. We know they're going into debt. We know that 1 in 10 Americans have medical debt, and that is totaling almost $200 billion today. And those barriers make care more expensive for everyone. It makes outcomes worse for everyone. Our work within the Cost of Care group is to try to, again, cultivate that next generation, but also to really applaud and move forward people who are from where they stand, they're leading from where they stand to improve affordability and quality, those two issues. That is why we're so excited to give this award today to Charles Holland, who is the CEO of the St. Bernard Hospital, which is a safety net hospital in the south side of Chicago in the Englewood neighborhood. His work has been previewed as elevating from the Leapfrog patient safety grade of F to an A and now double A at the most recent allotment within 2 years. And this has been lauded in USA Today, the Chicago Tribune. But we know that the work of affordability and quality starts far before the Chicago Tribune gets involved. And this work that he has done has really spanned decades, from improving affordability within this community with affordable housing to thinking about prevention as treatment. So that means improving access to primary care through pediatric mobile units. We know that it means improving access to dental care and to specialty care within the community. All of this builds into a community, a culture of both safety and quality, which is why we're so honored at Cost of Care to award Mr. Charles Holland with this 6th annual Steven Schroeder Award for Outstanding CEO in Healthcare. Hold this up.
Thank you so much. Appreciate it. Thank you very much. Appreciate it. Thank you all very much. It's quite an honor for me to receive this award. Honestly, it was humbling when I heard I had been nominated for the Steven Schroeder Award for Outstanding Healthcare CEO. I thought we were just doing the right things using the Leapfrog Group survey to advance patient safety. When it comes to affordability, St. Bernard Hospital confronts many costs of care challenges. We're an independent safety net hospital that serves the Englewood community, which is located on the south side of Chicago, where poverty, violence, and lack of resources are the norm. The result, a 30-year life expectancy gap compared to neighborhoods in Chicago that are just a zip code or two away. While Medicaid is our biggest payer, covers about 80% of our patients, another 5% of our patients have no insurance at all. We provide over $6.5 million annually in charity care, and importantly, we do not use collection practices for unpaid bills. Thank you. Despite Medicaid reimbursement not covering the costs of care and running daunting operational deficits year to year, we forge ahead with our mission to care for the sick and promote the health of all, regardless of their ability to pay. Our investment in wellness and disease prevention services, plus initiatives to address social determinants of health, likewise impact the affordability of healthcare. These efforts include building 77 units of affordable homes to bolster the economic stability of the hospital neighborhood, implementing a mobile health unit program that delivers vaccinations and healthcare services to school children, and developing in 2016 a 70,000 square foot ambulatory care center focused on wellness, management of chronic conditions, and preventing costly hospital admissions. I firmly believe that our status as a safety net hospital does not excuse us from investing in the safest possible care or from asking others to invest in us. My journey in that belief began in 2021. Up to that time, I was convinced that our care was safe. We complied with Joint Commission standards, CMS rules, and Department of Health regulations. Given the hospital's chronic deficits, how could we afford to do more? Then in May that year, my hospital received an F grade from the Leapfrog Group, and it was shocking to me. When I challenged my team to tell me how could this happen, the answer I got did not satisfy me at all. Because quality and safety were everybody's job, in fact, it was nobody's. Our efforts were totally diffuse and uncoordinated. That F grade was my personal wake-up call. If my hospital makes the claim, as we do, that every patient deserves safe, high-quality care regardless of their socioeconomic status or where they live, we had to walk the talk. We needed a leader who would focus every single day on keeping people safe and our patients safe. I was very fortunate to find someone who was up to that task. We hired Michael Richardson, who's with me here today, in the new position of Chief Quality and Patient Safety Officer. He immediately assessed our current situation using the Leapfrog Group survey as a roadmap. We invested in a just culture model that reshaped the hospital staff's understanding and language around patient safety. Michael brought a new energy and focus to patient safety as a core priority for the hospital. His work has been and continues to be nothing less than transformative. We evolved from thinking about patient safety as something we can't afford to invest in to embracing the fact that we must. For instance, knowing the impact hospital-acquired infections have on patient outcomes and costs of care, we invested in BioVigil's electronic hand hygiene monitoring system. We hired a director of patient experience to link more directly patients with safety and quality. That shift in mindset made a demonstrable difference. Last month, we received our second in a row A grade from Leapfrog. Thank you. We were very, very proud of that. Our efforts have gained public recognition of St. Bernard Hospital as well. They signal that a safety net hospital like ours is worth investing in. Earlier this year, Surfacide donated its Helios disinfection system to the hospital. Thank you, Gunnar. Showing his confidence in us. A family foundation that was totally unfamiliar with St. Bernard Hospital saw an article in the Chicago Tribune about our achievements in patient safety. They toured the hospital and talked with my team about the importance of patient safety. They followed that up with a significant donation to the hospital and then invited us to work with their board to further find ways to assist safety net hospitals. Recently, my hospital was awarded transformation funding from the state of Illinois to establish a Center for Better Aging at St. Bernard. The Center for Better Aging will have a focus on health equity of older adults and will address unmet clinical needs of the Medicaid and dual eligible population, improve their well-being, and enable better aging in place. Without our achievements in patient safety and quality, I don't think the state's investment in the Center for Better Aging would have happened, with St. Bernard Hospital as its epicenter. Reflecting on issues of affordability and quality of care helped me step out of the box into which safety net hospitals are often put, or are prone to fall into themselves. The typecast of safety net hospital is often seen as providing care that, as well as under-resourced, is not safe, of low quality, and just minimally good enough. My hope is that the motivation of the Leapfrog Group gave to me and to my hospital to improve our grade through the use of its hospital survey and the expertise the survey outlines to further and sustain improvements in patient safety, plus the recognition of the Steven Schroeder Award, can shed new light on safety nets. Indeed, our intentional work on safety has strengthened the net that keeps errors from slipping through it. Our net fosters the interrelationship between quality of care and affordability, between equity-focused care and well-being. And my job is ensuring the net is strong and resilient. Through this journey, we've learned also that safe care and affordability relate to factors that inhibit or prohibit a patient from getting care, such as transportation, lack of childcare, food insecurity, isolation, neighborhood violence, homelessness. At St. Bernard Hospital, we are taking all this in as we plan a sustainable path forward that holds the promise of reducing health inequities. We have already shown that investing in safe care brings its own value, a value which can be leveraged effectively to improve public trust, earn government investment, develop meaningful collaborations, attract philanthropic support, and re-energize a hospital workforce. Thank you again very much for this award and the recognition of not just me, but of my hospital and the leadership and energy of the entire hospital staff that has gone into making this happen and making such an exciting difference for my hospital and the community we serve. Thank you very much. Appreciate it.
Yeah, don't drop that. Congratulations to you, Michael, you and Michael and your whole team. And I think you just told me, Michael, 2 Fs to 2 As, right? What? Who's doing that? You guys are real heroes. Thank you.